There is a single silver bullet inside of the 1986 National Vaccine Injury Act and under the 2005 PrEP Act, which is that there was a felony committed in the process of promulgating an emergency use authorization. Then the corporate liability shields that protect companies like Pfizer and Moderna and Gilead Sciences, and that protect the hospitals and the consolidated healthcare organizations. Those civil protections against liability exist only if there were no felonies committed in the creation of the emergency use authorization. We know that from racketeering, from lying to Congress, and from now premeditated and negligent and reckless homicide, we know that there are a number of felonies that have been committed. What we're now doing is actively pursuing the enforcement of law enforcement around the country to bring those felony cases forward so that we have a pierce of the liability shield that currently is the reason why the pharmaceutical companies and the healthcare companies and everybody else thinks that they can operate with impunity. Real human beings right now are being murdered by people in lab coats today, right here in Salt Lake.
I'm going to be very clear about this, and I've recently just testified in the U.S. Senate, December 7th, 2022. The vaccine is killing people and is killing large numbers of people. It fulfills all the criteria for the Bradford Hill tenets of causality for a medicinal product causing death. Our CDC, as of December 23rd, 2022, has over 16,000 Americans that have died within a few days of taking the vaccine. And that's probably a gross underreport.
Right now, we know that in New York, the mayor of New York City has said that he's going to give children, are you ready for this, $100 candy money if they agree to the injection. Think about that. We were always told when we were kids, don't take money from strangers. Don't take candy from strangers. Well, guess what? The mayor of New York is saying, take money and candy from strangers and change your genetics, change your health, change your life in perpetuity for $100.
New York City is extending the $100 incentive to kids who get vaccinated at city-run sites or at their schools. Children ages 5 to 11 are now eligible to get the Pfizer shot. And News 4 talked to one mother and daughter who say they're doing their part to beat the pandemic.
Well, I'm a little nervous, but I'm also excited. I don't want to get COVID or Delta variant.
We were really excited about going forward to make a small contribution to the health of New York City.
Starting on Monday, kids can also get vaccinated at pop-up sites at their city schools.
So as we sit here today, if the topic of discussion is childhood vaccination, it is clear, based on publications of representative data, that the risks far outweigh any potential benefits of vaccinating children. And the data are clear. And in the last few weeks now, reports have come in, one from Connecticut, with oversight from the pathology from the University of Michigan and from the University of Minnesota, on 2 teenage boys who died on days 3 and 4 after the Pfizer vaccine. And the parents were horrified to find the children dead at home. Autopsies were performed, and the conclusion was crystal clear. The vaccines caused the death, with massive heart inflammation and evidence of superimposed catecholamine injury on the heart. Fatal reports have come in from Choi and from Verma, Choi in Korea, Verma from Washington University in St. Louis. It is clear that a vaccine is being pushed, is being encouraged, and mandating that, in fact, results in death of children. Results in death of children. One death is too many. As I've shared with you, in millions of children receiving the vaccine, they don't die of COVID-19 respiratory illness, but in fact, they die of the vaccine.
And just a short time ago, I asked Dr. Anthony Fauci about the president's sweeping new requirements.
There are a number of people, for one reason or other, who just do not want to comply and get vaccinated. We've got to get them vaccinated. And hopefully they will do it willingly. If not, there will have to be things that will essentially put pressure on them, such as you're not going to work in this particular agency or institution. You're not going to be able to go to this college or this university unless, in fact, you get vaccinated. And I believe that once we start doing that, you will see more and more people willingly get vaccinated.
Los Angeles schools are talking about requiring vaccines for children 12 and up. Is that a model you think would be useful for other schools around the country?
Lester, I do. I do believe that that's the case. And this is not anything new. We have requirements for vaccination for a number of other diseases in the school system. So it would not be a unique situation to have requirements of children 12 years old and older to have the vaccination for COVID-19.
Just days after getting their second COVID-19 vaccine, 2 teenage boys died in their sleep. Medical experts have been investigating what happened and have now released their report. An epidemiologist says it adds to a body of evidence that confirms Pfizer's vaccine can lead to death in children. NTD's Miguel Moreno reports.
To attend class in some parts of the country, kids need to be vaccinated against COVID-19. The federal government says they're safe, but gives them warning labels of what could lead to death.
This myocarditis warning that is out on Pfizer Moderna is very serious.
Epidemiologist Peter McCullough says this in light of a new report. Its authors investigated the cases of 2 teenage boys from different states. Both of them had received second doses of the Pfizer vaccine, only to die a few days later in their sleep. McCullough says that in his view, the study confirms that Pfizer's vaccines led to the deaths of the teenagers.
Right? These are crimes that are being committed, and we need to stop those crimes. But the only way we can do that is to have the corporations that are actually administering these agents liable for the damage they're creating. Because I can assure you that the day Moderna or Pfizer or Gilead knows that they will have civil penalties at up to $100 million per count for every death and every injury they created, I can assure you they'll stop supplying the injection. They'll stop supplying remdesivir. The minute they know that they are on the hook for the liabilities they're actually creating, they'll stop doing it. And so what we're doing right now is we're working very aggressively to take felony convictions forward so that we actually have the ability to hold the perpetrators accountable and ultimately destroy the very fabric of the system that allows human beings to be sacrificed on the altar of an agenda.
The vaccine is neither safe nor effective. This is very important. And you asked about motive. What could motivate a stakeholder?
The stakeholder concept of stakeholder capitalism.
To want to enact a worldwide mass vaccination program of a vaccine itself, which scientifically and medically is neither effective nor safe, that has no proven outcomes, and want to vaccinate individuals of which the disease doesn't cause any problems. So there is a goal and stated goal to vaccinate children down to 6 months old. Wait a minute. This isn't a disease for 6 months old. It's not even a disease for 20-year-olds. The bottom line is this is an innocuous disease that has an incredible age dependence to it. So what started out with this idea that maybe a vaccine could be good and we'll just vaccinate nursing home workers and seniors and protect people and get through, became this ever-encroaching, ever-expanding mass vaccination program that has now raised all of our concerns, because there's a concern that this isn't about COVID at all.
There were significant obstacles created to suppress access to life-saving information and life-saving medications that work incredibly well.
My estimate is 85% of the deaths could have been avoidable.
Well, I think this is genocide and a crime against humanity and mass murder.
Through this vaccine program that we basically have set up exactly what you said, genocide.
So can you name any of the perpetrators now that would be likely to be charged?
Absolutely. So at prosecutenow.io, we have a ton of information, including a series of draft indictments. We specifically call out the perpetrators in chief. We know that Anthony Fauci colluded with Ralph Baric in 2014 to violate the gain-of-function moratorium and weaponize coronavirus. We know that happened. And we know it because we have their documents in their own writing that admit to that. We know that Ralph Baric and Peter Daszak worked together with the Wuhan Institute of Virology so that in 2016 they could publish a paper that said that the SARS coronavirus was poised for human emergence. And the virus they made reference to was one called WIV1, which stands for Wuhan Institute of Virology Virus 1. See, these are those things that are so self-evidently criminal that in 2016, during the gain-of-function moratorium, we could have a Chinese weaponized virus ready to be poised for human emergence. And out of the back of that, we actually have the admission by Peter Daszak, by Ralph Baric, and by Anthony Fauci that there is going to be a pandemic that's going to happen under the presidency of Donald Trump.
Given, as you heard from the introduction, that I have been around for a while and have had the opportunity and the privilege and the pleasure of serving in 5 administrations, I thought I would bring that perspective to the topic today, is the issue of pandemic preparedness. And if there's one message that I want to leave with you today based on my experience, and you'll see that in a moment, is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak. And I hope by the end of my relatively short presentation, you will understand why history, the history of the last 32 years that I've been the director of NIAID, will tell the next administration that there's no doubt in anyone's mind that they will be faced with the challenges that their predecessors were faced with.
These are all things that are out in the public. These are admissions of racketeering. They're admissions of collusion. They're admissions of premeditated murder. And by the time we get to 2018, and this is the most important piece of all of this crime, Ralph Baric, the inventor and the weaponizer of coronavirus, also had the hand in developing remdesivir, the drug that was allegedly used to treat patients with COVID, except for the fact that by 2018, that drug had a kill ratio of 53%. Documented, published. It was so deadly that the World Health Organization itself pulled the drug from consideration for Ebola treatments. And ironically, inside of the documents that nobody bothers reading, the death rate occurred regardless of viral load, which means that people were killed who didn't even have Ebola. We murdered people. And by we, I mean the complacent and ignorant masses that have agreed to let these things go unchecked. Murdered people in Africa. The death rate at 53%, and we let that publication of information in 2018 fail to inform our decision in the spring of 2020, when Anthony Fauci, Ralph Baric, Peter Daszak, and others made the decision that we should inject remdesivir into patients with COVID. We knew we were going to kill people. That's premeditated murder. We knew we were going to do it, and we went along with it anyway. And sitting right next to the president, Donald Trump, he signed the death warrant for millions of Americans, with the criminals sitting right next to him. Possibly one of the most interesting coups in human history, where the perpetrators of the coup were literally sitting in the Oval Office on a sofa right next to the president. And what he didn't know is that he was signing the death warrant to American citizens.
Do you do that and present a little bit detail, because it's quite good news, and I'd be happy to share it with you.
Want to talk about it now? If you want. Go ahead, please.
Okay, so a trial that the National Institute of Allergy and Infectious Diseases, which is the institute I direct, sponsored, called the Adaptive Covirus Disease Treatment Trial, or ACCT-1, was started in February 21st of this year, and it was a randomized placebo-controlled trial comparing the Gilead drug remdesivir with a placebo.
The Gilead study confirmed giving remdesivir for 10 days to 53 COVID-19 patients early on before May 2020. They found that it caused multiple organ failure, acute kidney failure, septic shock, and hypotension in 31% of all people they gave it to. And multiple people in that 10-day trial Their kidneys died and needed emergency kidney transplants. Why did this get my attention? March and April of 2020, New York City was reporting as the epicenter of COVID-19 in America. Every press conference I watched when they were interviewing medical doctors, they all stated the same thing every time. Every time we start treating these respiratory virus patients with this new novel coronavirus, this respiratory virus moves from the lungs and goes to the kidneys. We have never seen a respiratory virus ever attack kidneys like this before. It causes such severe acute kidney failure, we're not only short on ventilators, we don't have enough dialysis machines to handle the kidney failure. I knew right away from the Gilead study conducted 2 months earlier that the entire kidney failure, multiple organ failure, was a result of remdesivir and had nothing to do with the virus. And that is absolutely true. I said in May of 2020, went into the media, I said everyone needs to be warned that Anthony Fauci has declared a drug to be the solution to a pandemic for all innocent Americans. He is going to kill hundreds of thousands, if not millions, of innocent Americans with this drug.
Attorneys Dan Watkins and Michael Hamilton announced at a national press conference on the 7th of this month the filing of their landmark lawsuit against these 3 major hospitals on behalf of families who lost their loved ones with the bounties paid to hospitals for using remdesivir. I like that they're using it, the bounty that was paid.
43,000 Pennsylvanians have died from COVID. They died from COVID treatment. Peter McCullough just gave us a statistic of like 93% could have been saved. I'm going to tell you right now, 40,000 of them died from the ill-advised hospital protocols in your hospitals.
So we had, so you've named Fauci and Barrick.
Dashik. Yep.
There's quite a few others.
Oh, there's a whole host of them. And what's being done right now is working together with some very courageous sheriffs, some very courageous DAs. What we're now doing is we're compiling a series of actions where we have now thousands of patients who have died. And we're aggregating those into a unified action so that we can actually make a very public statement of what is in fact the felonies that we hope to end the EUA.